Welcome back to Iowa Live. Lou and Michelle here, and time to visit with Todd Skemper. He's the clinic manager at Kinetic Edge, talking about something that really you want to pay attention to make yourself feel better in more ways than one.
That's
Michelle.
right. Welcome. Good morning.
Thank you. Good morning. Good to be here.
The last time you guys were on, it was all about, kind of restoring hope through movement. Talk about how important it is for all of us to, the movement and staying mobile, and how you guys can help with that.
Yeah, that's a big part of what we do is really helping people with hope when they aren't able to move. There's a movement challenge. Maybe they can't do stairs anymore because of knee pain, or they can't reach up with their shoulder, or bending over is a problem. So we're trying to help understand that problem and help them find solutions to deal with that.
Because that really affects the psyche of the person
Yeah, that's what I was just going to say, quality of life.
And so how does it work out? What's the first step that you take in order to get people moving in a positive direction?
Well, really, the first step is when they come in, is getting to know what their goals are, getting to know what they want to accomplish. We see our patients as the hero, and we're just there to guide them. So if we understand what their goals are and what they're limited with, then we can start to evaluate what's going on, how they're limited, what's not an option for them anymore, and then putting together a plan to work towards those goals.
For people that really maybe aren't familiar with just physical therapy overall, kind of talk about what it is you guys do and focus on, aside from, of course, obviously movement and so forth.
Yeah, I'm glad I can come talk about that, because a lot of people don't understand what physical therapy is. And in Iowa, you have the option to come without a referral. So we can see patients. If you're dealing with some back pain, come on over and we'll help you out with that. And
you will.
You bet. If you have a referral from your doctor, we appreciate that too, and can help people with those. But we're going to help understand those movement challenges and start looking at what can we do to help you move better. Things that we really focus on would be hands-on therapy, working on improving joint mobility, improving muscle length, those kinds of things, and then really digging into the specific exercise. What strength need do you have? What tightness do you have that we can work through? And then really educating. And that's a big part of what we do, really looking at the posture issues, body mechanics, how we can move differently to help feel better.
Now, what are some of the reasons people come to you in the first place? Is it always injury related, or is there some other aspects that come into play as well?
Yeah, often just a pain pattern, that's something that they've been dealing with for a while, or maybe they've been in a car accident and having some issues with that, or even a work injury, or those that have had surgery and are trying to get back on their feet and recover from that.
So it could be just a medical reason in general, wouldn't necessarily be something because you're injured.
Right, not necessarily just from an injury. It could be just a chronic pain issue that people have tried other options and they haven't found the solutions that they want. Now,
can you think of a case that someone has come into your facility where their movement was very, very limited and you had just major league success with them?
Yeah, I was thinking of somebody I worked with the other day who injured their knee, and they were in a pretty tough situation. They've had medical tests and nothing was helping them, or they couldn't even figure a diagnosis, but really worked through understanding how to rehab the muscles, how to loosen things, how to restore some of the strength that they're dealing with, and get them back to the things they want to do.
Now, what's all entailed with a visit to your facility, for example? Somebody comes in and they have a knee issue. Maybe they're having a hard time climbing stairs. That seems to be a common one here. What would be your first process to say, okay, here's what we need to do, here's what we're trying to accomplish? What would be your first thing you do?
Yeah, I think, again, going back to the evaluation.
Really, after the evaluation, but what type of physical thing would you do?
A physical thing would be to start with some exercise that, maybe they're having trouble with a 6-inch step. So maybe we start with a smaller step and start trying to build them up to that level by getting some of the strength back. Or if there's a limitation with their knee, maybe we're going to do some hands-on therapy to mobilize their knee joint or to loosen some of the muscles around their knee to help them be able to freely move that joint segment, or segments above and below, looking at their hip to understand if there's some tightness in the hip that's affecting their knee, or maybe they have an old ankle injury that's now affecting their knee that they didn't really understand was a part of that big picture.
All right.
And I love the fact that this is such a non-invasive type of therapy, and maybe not the need for medication and so forth, and it's just through the moving of the body, and you guys being specialized in knowing what those moves are to actually get the healing and the improvement that they're looking for.
Yeah, it's not as scary when we don't have scalpels in our clinic. So.
Yeah, which is nice. That could be something you want to let people know. They don't have scalpels in their clinic. But is this something that people come to your place on a regular basis, or is this where you give them ideas of what to do when they go home? Or how does this work? Is this a couple of times a week, once a week?
Yeah, it's really both. It's us helping them figure out what to do, and then they take that information home and work on their program. Really, if people want to get better, they want to see results. If they do their home program, it's going to happen a lot quicker. Often we'll see people a couple times a week initially, and then kind of taper them down to once a week, and really getting them to a point where they're ready to go and do the program on their own when they've met those goals.
Talk about the importance of, you mentioned about not needing a referral, because I think a lot of people associate physical therapy with having, a doctor needs to send me to a physical therapist. So, and the importance of the people, you don't need that.
Yeah, we're a private practice, a physical therapist-owned practice, so in kind of the world we live in, the rules may be a little bit different than in a hospital situation. So often we do have people use us as their primary care provider for musculoskeletal injuries, which is more joint, muscle, those kinds of things. And if we find out that they have a greater need, then we would refer them to a sports medicine doctor, podiatrist, family practice, orthopedics, that kind of thing, if we feel like the thing they're dealing with is more than what we can handle.
So the best thing for people to do is come in and get they're having a problem with something, come in, get an evaluation, and then you guys can guide them through what the proper
and a point there is if you deal with something earlier, you're going to probably get better quicker, and it's probably going to cost less too in the long term.
Don't put it off.
Don't put it off.
Best news of all. Now, people know that where your place is located over on 3rd, right?
Yeah, 516 3rd Street downtown is where we've been. I've been at that location for about 13 years now. We've have a great team there, and we like that about Kinetic Edge. Our culture is really having a great team that works together to help our clients out.
And just a couple of days ago, you unlocked the door somewhere else. Tell everybody where else you opened up.
Yes, we did. We opened up in Waukee on June 3, just a few days ago.
Right.
Patrick Ford is our lead therapist there, and he's open for business Monday, Wednesday, Friday. And we are actually having an open house next week on June 12. From 4 to 6 p.m. So we'd love to have people come visit us at our Waukee location in Sportsplex West.
That's a great hour. An open house is a great opportunity to just kind of come in and check it out and see what's.
And that's over on Olson Drive off of Ellis's Road, 890 Southeast Olson Drive in Waukee. So convenient for people over on the west side of town too. So, and again, you say Monday, Wednesday, and Friday from 8 till 4:30, which is a perfect time for a lot of people to get in and get out.
Yeah, those are our initial hours for Patrick there, and as we see a need, we're going to expand those hours.
I like the fact that you can come in if you have an issue and they can help you work through without having anything additional. Just use your physical movement to get you feeling better.
And they give great guidance on the things you can be doing then on a daily basis at home as well, in addition to the appointments that you have there, which is nice. Keep it going.
But the first thing you need to do, the initial thing you need to do to get the information that you need is visit your location and visit your place. What's the best way to get a hold of you?
I would say check the website first, kineticedgept.com. You're going to have all the information there as far as contacting any of our clinics. If somebody wants to set up an evaluation or an injury screen, just contact one of our care coordinators.
Okay, an evaluation, injury screen, how much time should they allot for something like that?
Yeah, screen is going to be a little bit shorter, about a 20-minute time frame, and then initial evaluation is going to be 40 minutes or more, depending on the patient's need.
Okay, and what's an average visit? Once you determine, yes, you guys are going to be able to help, which chances are really good they will. What's a typical visit? How long does that normally last?
Yeah, 40 minutes up to an hour, depending on what we need to do.
So you can really schedule it around your personal schedule and make everything work. Perfect. Well, thank you so much for coming in.
Thank you. Good to be here.
Amazing. I appreciate everything you guys do.
Thank you very much.